Today's episode is sponsored by Vitality Health RX Supplements. Whether you're an athlete, a busy professional, or just someone looking to prioritize health, Vitality Health RX has what you need. With premium ingredients and rigorous quality control, their supplements support your body's natural functions. Visit shopvrx.com and use code FEELGREAT15 for 15% off your first order. Thanks to Vitality Health RX for sponsoring this episode. Now let's dive in.
Hi, I'm Dr. Andrea McSwain, and welcome to the Feel Better, Feel Great podcast, episode 136, Move to Remove. Did you know that regular movement can help prevent fluid retention and improve conditions like congestive heart failure, or CHF, lymphedema, and even kidney issues? In this episode, I'm going to explore the link between movement and fluid management in the body and how it can improve your overall health. All right. So before I get started, I want to remind you that this information in this podcast is for educational and informational purposes only. Always seek the advice of your physician or other qualified health providers with any questions you may have regarding a medical condition or health objectives. Welcome. Today, I'm talking about movement and its crucial role in supporting the body's natural pump system. Whether it's the heart, lymphatic system, or the muscles, movement keeps fluid circulating and prevents stagnation. I think you might feel skeptical because this is a really big medical topic. And I know you might be asking, like, simple movement, how can that actually help my heart work better? How can it help my muscles, right? How can it move fluid? Well, there's a lot of science in this. I have a lot of clinical evidence as I've worked through this over the last few years and trained other people as well, other clinicians in this area. But it does matter. How we move and that we do move really matters. And that is because the body is a pump, okay? Every tissue pumps. Now, it's very easy to see that with the heart, right? Because the heart is a big pump. Its job is to be a strong enough pump that when it squeezes, it pushes blood all the way down, down into the abdomen. It separates and it goes down into the legs, and it then water sheds into the cells. And then we have to actually pull that fluid up, partly through the venous system, partly through the lymphatic system. And that requires a lot of support of the pump in order to get it up and out. Okay, so we all know that the heart, right, pumps red blood down, right? This is the adage, right? It goes all the way down. It eventually gets to the tissue level and then the cell level. And at the cell level, the red blood cells are quite large, right? They're about the size of a cell. So you have to dismiss the oxygen into the cells using a watershed effect, right? And then the watershed effect through pumping collects back into the venous system, and that's where we see the blue imaging always, that the blue venous system is pumping up. And then we also see the lymphatic system, and that's where people think about lymph nodes, right? The body's got a cleaning system, and that's the lymphatic system and those lymph node chains to kind of pump that gook up and kind of isolate it from the blood. Then the venous system also has to have a lot of valves because the blood can backflow in the venous system. So we really have to support a really strong pump. The other issue with that is a pump is so important because of gravity. And gravity pushes down on us. And so fluid can pool unless it pumps. Okay, so you can really think about the heart. The heart is a big pump, and that's how it delivers oxygen and nutrients to tissues and then removes waste products. So every cell makes waste, and we've got to pump that waste out. Okay, so lymphatic system is a very complicated system. A lot of people don't even really learn about it. They don't understand it. But basically, just think about that fluid at the cellular level, just kind of getting stuck, that the tissue starts to kind of have that stuck feeling because there's some waste products that don't quite get removed between the all the nutrients and the oxygen coming in with the good healthy blood, and then the machine of the cells working, and then the waste doesn't always get accumulated, particularly if the cells don't have that kind of invigorated squeezing and releasing action, especially when those things happen with things like the congestive heart failure, or the heart starts to have less pump. So lymphatics are definitely a space that can create fluid buildup in the tissues. So what happens with the muscles, right? The muscles, we know they love to pump. They contract and expand. So they close and they open and they stretch during movement. So they help push fluid, including blood and lymph, through the veins and the lymph vessels. And this helps prevent stagnation or fluid pooling, right? And so if you think about how the muscles in the lymphatic system and even the blood vessels are all organized in the body, the muscles actually give that good squeezing effect. And there's two really good places where people can understand how important it is for the muscles to serve as a pump and its relationship to congestion of tissue or stagnation, right? So I'm going to use these terms interchangeably. Those two of those places are, one, the calf muscles. The calf muscles have a lot of lymphatics in them so that it can facilitate the pumping action, right? Because the feet are the end of the road. So we really have to use those calf muscles to really help pump the fluid up. So there's a lot of effort of the body to really pump those calves. Another area is in the neck. So this is called the sternocleidoid mastoid muscle, or the SCM. It goes from your collarbone into your inner ear, actually, and the mastoid, and it connects also to your inner ear, the stapedius, just FYI. And what happens is there's a ton of lymph node chains in here. There's a lot of lymph nodes, and there's a good amount of lymph node chains, obviously. And then when we squeeze these areas, we support the drainage, okay, of the head that happens because of congestion in the nasal passages, in the sinuses, right, in the ears. So people who have a fullness here likely have a lot of tenderness in this muscle because the lymph chain gets congested, because the muscle isn't doing a good job of pumping, either because people have their head stuck like this, or other things people do with their neck, I don't know, further back, etc. So you can appreciate it, hopefully, with these examples. And that's what I'm trying to show you, because the body has to move fluid, okay? And so there are many pump mechanisms to move that fluid in the body. And that's why when I brought this up, I talked about kind of this almost seemingly taboo structure, or this seemingly taboo conversation of congestive heart failure, because people who have a big diagnosis like that are often just told to go home and do nothing, right? Because it's too overwhelming for them to do anything. And I get that. The heart is very tired. But in working with your medical provider, start to question, can I make the pump stronger? And people talk a lot about that after myocardial infarction or heart attack. There's a lot of cardiac rehab facilities. But what are people doing when congestive heart failure is the diagnosis? And a lot of times people are just sitting around, and that is exacerbating the problem. So one, prevention is worth more than a pound of cure. There's no way around that. Two, how can you actually understand what's happening if this is one of your diagnoses or this is prevalent in your family, so that you can prevent it? Or if you start to have that diagnosis and you're in early stages, you can start working on it. And I know that can sound unbelievable, that you can actually heal, but the body is inherently designed to heal. This pump system is inherently designed to work. There are so many patterns and structures in the body to facilitate the movement of fluid, because if they weren't there, we would not be able to make it as long as we do in this machine. So this machine has many pump systems, okay? So that's how we can support you to facilitate the pump Okay, so think of your body as a pump. And when I think of fluid stagnation, I do think there's a role for movement, because movement is facilitating the pumps and the pumping mechanisms of the body. And that's why the muscles, right, have the pumping action. The heart is a huge muscle. It's such a powerful, huge muscle. And then you have other muscles, right? Actually, the heart is so cool because it actually has a ton of mitochondria. It needs a lot of CoQ10. It needs a lot of oxygen. It's a specially designed muscle. So when it starts to not be able to pump very strongly, what can you do to nourish that? What can you do to provide more support so that the muscle of the heart can start improving as a pump? What can you do with the muscles of the other parts of the body to move that waste through, move that fluid and stagnation through? And so that's what I mean by movement. Now, sometimes you might actually need support with that, and there are professionals that can help you. Some are much better than others, and that is a very clear thing to recognize too. So please remember that without movement, fluid in the body, including blood and lymph, can become stagnant, and this will lead to symptoms like swelling, inflammation, and increased health issues. But I want to make sure when you think about movement, you're thinking about facilitating the pump of the body. I'm really not necessarily talking about going and hitting it hardcore, right? I'm not talking about an intense exercise routine right now. I'm talking about a concept, because a lot of people, I hope, who are listening to this actually have this problem, and they actually are seeking ways to get better. Because what often happens so much, because this is a concept, a physiologic concept with an anatomical concept as well, people just don't learn this information. A lot of times healthcare providers who work in areas related to congestive heart failure or lymph swelling or leg swelling, or the pelvic floor swells, or pelvic venous congestion, arm swelling, the hand swell, they just don't have the time. They don't allocate the time to discuss what is happening and what you can do about it. You're often just told just to go home and deal with it. Go home if your legs swell. It's just how it is. You know, if your heart's slowing down or it's not pumping efficiently, well, that's just how it is. And that is not true. This could be everything for you, and I really hope that it is, because there is just so much that can be done in the prevention, which is the treatment. Okay. So again, what are medical conditions related to with fluid retention? Congestive heart failure. Okay. So when the heart is unable to pump efficiently, fluid builds up. Where does it build up first? You might be seeing some fluid retention in your feet, in your legs. Sometimes in your feet, that actually feels like plantar fasciitis. So the bottom of your feet gets really achy when you walk, or your heel hurts a lot. It might be that the fluid is being retained or kind of stuck in the tissues of the feet, because that's the furthest point away, right? And that's the gravity system that's affecting our bodies. Then it starts to go up. Maybe there's some knee swelling, some back of the knee swelling. Maybe there's some swelling on the insides of the thighs. Maybe there's a little bit of a elevation of tissue over the bladder. Okay. Maybe there's some congestion in the pelvic floor, and then it starts coming up and up and up. You know, maybe there's some bloating in the gut. Maybe there's some swelling in the armpits. Maybe the arms have some heaviness, right? And again, maybe this area in the neck is full and very, very tender, because the body really likes to not have a lot of extra fluid in it, right? Because fluid is a space that can actually allow for problems to form. This is very important, because when fluid accumulates, it can cause a lot of problems with the fluid. There's a lot of waste products stuck in there. The cells have to endure this heaviness, right? So that even makes it harder to pump even more. So we want to make sure that we can facilitate this pumping and keep the fluid going. And so any movement that's light is better than nothing. So some people, particularly if they really struggle, can think about, what are some laps. I like when people do laps, right? Because then they can always evaluate. So smaller laps, maybe around your house. You do a lap, you might need to stop and rest. Okay, then you might do another lap. Or you might say, you know what, I'm done. This is exhausting me. I'll come back in 3 or 4 hours and do another lap. Okay. Again, it's very important to work with your healthcare providers. It's really important to require them to talk to you about this information because your life depends on it, especially when you're looking at the heart pump having problems. Just remember, there's a lot of great things that you can do that make sense when you think about the heart as a pump and you think about fluid getting stagnant. Okay, so lymphedema. This is often closely tied into when lymph nodes are removed in the armpit for women who have breast cancer. And so they'll end up getting a lot of caution that fluid can pool in the side where they had the lymph nodes removed. Okay, so if you ever need scientific or medical proving of lymph and its relationship to swelling, it definitely exists in the situation where lymph nodes, right? So part of the lymphatic system, lymph nodes are removed from this area when they are biopsied to evaluate if there's cancer in there. And the ramifications are peripheral swelling. The swelling and the fluid get stuck here because the lymphatic system pump is altered and diminished. Okay, so that is called lymphedema or lymph swelling. It can often happen in the legs where the legs get really full and stagnant. Okay, now they also can be extremely tender. And you can have lymph in a lot of areas that are extremely tender. This is definitely a litmus test for that because this can be very tender for people, particularly around sinus congestion season. This is where I really like to support people by doing things that make a lot of sense to reduce swelling. I like to get them in the medical spa. I like them using KPS products to actually move waste out. A lot of people who talk about lymphedema and therapies for lymph, they might be moving them physically, but they don't have the nutrition coming in to facilitate the removal. And so they're relying on pathways that are already overwhelmed and that are nutritionally deficient. That's why in my clinic, I work with KPS Essentials, and in our medical spa, we use a treatment called SlimSage. It's a lymphatic treatment where we add nourishment to the tissue, we heal the tissue, and that amplifies the pump because now that tissue is nourished. Okay, so sometimes going in and trying to improve a larger system by moving lymph, it's effective for some, like I'm good at it as an osteopath. I'm very strong in this. There's a lot of osteopaths who are very strong. There's a lot of other programs that are actually very poor in doing this. So if you're working with someone and you're not getting results, you need to look for someone else. And you want to find someone who's results oriented with lymph. And I will tell you that happens with KPS Essentials. It happens in our medical spa. And that's really important because it's not the end of the road. You can move this fluid out. And you need to work with qualified professionals who know how to do it and get results for you. And you may very well remember, listener, that your role is to think about how movement can support the pump, okay? And that can actually be pretty fun if you maybe turn on some music and start, listening to that and start moving, start finding joy, start thinking about things that make you happy. So then the heart will start pumping more, the body will start wanting to move more. And that's very important. Definitely getting back to some other significant medical conditions related to fluid retention. Obviously, kidney disease is a very important one. Kidneys are a very important organ to helping move out fluid. Sometimes they can get overwhelmed. And so you want to work with a healthcare provider that knows how to work with someone with kidney disease and how to reestablish the kidney's ability, because kidneys are organs that need specific nutrition. It's very helpful It's also very helpful to recognize that the location of the kidneys compromises their integrity sometimes because they're right at that change, that junction between the thoracic cavity and the lumbar cavity. And anytime you have an intersection anywhere, that area can get compressed, can get backlogged. And kidneys are there for a reason, to support the pumping, but when that intersection gets kind of jammed up, the kidneys can get involved with that as well. And so that can facilitate a fluid retention issue. Can either go good or not good. So you want to facilitate the kidneys and where they're positioned to reduce fluid buildup. Has a lot to do with the fact that the kidneys are right next to that thoracic outlet diaphragm. Okay, venous insufficiency. Okay, and I've kind of elaborated this a little bit in the beginning, but veins have thin walls, okay? They have to have a lot of support of the tissue that wraps around them in order to really get that squeeze going. And what makes it worse? The fluid that's in the tissue doesn't allow for that tissue to give that good squeeze on those veins. So then what happens? That squeeze doesn't happen. So that those veins are pretty insufficient to get that fluid up. That's why there's valves and that's why there's surrounding tissue. So the veins physiologically really rely on that peripheral tissue around the veins to be able to give that good squeeze. So if the veins start to pool, right, they can't get that squeeze, then they're going to have insufficiency, they're going to have congestion, and then they're going to kind of backlog. And that's why we can often see veins in varicose veins in the legs, because they just don't have that pump. And sometimes it's not about the legs. Sometimes it's about the pelvis, particularly in women, maybe women who've had children who have now developed pain around in the pelvic area. This is called pelvic venous congestion, right? Or pelvic floor congestion. And as a result, the fluid backlogs into the legs. So I think that's really an important consideration, is not just what's happening exactly in the area, but what's happening around the area. And when related to gravity and pumping things up, what is a blockade for that pumping up action to happen? And that often happens in diaphragms, pelvic floor diaphragm, thoracic outlet diaphragm. Those are two big areas that can get locked up and then affect the fluid movement in the body and can cause fluid retention. That's how we move, right? Function follows form. And when we have good form, we have good function. Okay, so, the muscles pump the fluid, regular movement, even small regular movement. What do you do when you wake up in the morning? Like literally, what do you do right when you wake up? Because that is the time you can start thinking about how your body's moving, how your body might have been stuck in a position for a really long time. I talk about sleep posture. I'm going to talk about it even more. But basically, if you're curled up in a ball, when you wake up, uncurl yourself, right? Open up your chest. Feel your fingers, feel your toes, start to get movement in them. This is before you've ever left the bed, right? Shift around a little bit. Start to recalibrate. How are you in your body? And then maybe spend a few moments in the bed just feeling that pump when things are leveled out. Some people have fluid retention when they wake up. So their joints are sore. That's often because they've got some kinks in some areas in the body. And so they have some dysfunction because the form is either tight, they're curled up in a ball, they're clenching, things of that nature. Okay, so when you get up, evaluate that and put a little movement in before your feet ever touch the ground to see if you can facilitate some of that opening and that pumping. Okay, then think throughout the day, how is my body pumping? Right? I was recently at I was giving a lecture, I had a wonderful time, but I ended up sitting to participate in the subsequent conversations, and I kind of felt like I had attached myself to the chair. I was like, whoa, I need to get up. Like, I need to feel movement happening. Okay, so Sometimes too, that trick that I love is every hour at the top of the hour, spend 59 seconds moving, like little squats. Stand up, stretch your side bodies, because that's a really good place to open up those diaphragms, the pelvic diaphragm and the thoracic diaphragm. And do maybe 5 of these, like side crunches, and then come to the middle, okay? And then kind of maybe move your arms out, maybe move your arms back and do that a few times, right? And then do the other side and come do that a few times, all right? And open things up and then come back to the midline and reset that. Either this or, putting your hands behind your head or stretching up your chest, kind of breathing in with your whole chest because you want to facilitate that pump. And when you do that, you keep the pump going. So that is, something that's very invigorating every hour. It gets those muscle fibers going. For some people, that muscle fiber stimulation will last for the entire hour. And they have this effortless effort in their muscles because now their muscles are invigorated. They had a little surge, right? Little surge, nothing crazy. And unless that's for a different episode to have like something that's really go-getter. But in this case, you're just reinvigorating the pump. You're getting that stuff open, you're moving out that congestion, and you're spending that 59 seconds, right, to open, lift up, get some things moving, and then see how long that feeling stays in you. Because that means that fluid is really getting to shift and pump. You're improving the circulation, not just the cardiovascular circulation, but then what's actually happening even potentially at the tissue levels, right? And that pump is circulating and supporting the entire body. That's how movement is essential to support the body's natural pumps. Prevent fluid stagnation, live a long, happy life. Never hear these words like congestive heart failure or lymphedema or venous insufficiency or kidney disease, right? I mean, these are all the things we never want to hear. So let's work now so we don't ever hear those in the future. If you are hearing those things or they are occurring, I hope this podcast episode really helps you understand kind of a general concept of what needs to happen in your therapeutics to heal the body, nourish the tissue, move out toxins, get that pump going, and then build that pump. If you have any questions, please put them in the comments section for the podcast. Please share. I know a lot of people who deal with this have been told a lot of information. I'm not really expecting to change everyone's mind on this. I just think if you can just be open to this idea, then I feel like it can be very, very helpful. I have worked in my clinic with patients with congestive heart failure. We have moved lymph for lymphedema related to cancer patients. When you see someone who's like 90 years old, right? I mean, that's pretty cool in and of itself. And then the fact that like one person there, so we have a patient, she's 90, more than 90 now. She's marvelous. And for years had one side, her left leg was larger than her right. Okay, so we started moving the fluid, pumping the fluid. She had some massages that helped facilitate movement. And we started actually getting a little bit more alignment in her knee to open up her calf so that she could start pumping more of that fluid out. And she was able to retain a lot more balance between her left and her right leg for quite a few years now. So I think that's a general overview of that case study. But nonetheless, we can keep that pump going. We can make it stronger. Wherever you are is the right time to get started. And I hope that you resonate with this. I hope you share this message for people who might benefit from our discussion. I want to look forward to our next episode, which is called Feeling Drained. I promise for it to also be informative and helpful, because if you are feeling drained, I'm calling all of those who are feeling drained, then let's get started on feeling better and feeling great. Thank you so much.